Claire here at StudentRDH. So we're going to go over how we can solve our accept or false question easily. I don't know if you have the experience, but sometimes you go to your professor and say, I think I got this right, but then when you go back, it was actually an accept or false question. What happened is that you panicked. When we read books, we are just memorizing true information, things that we have to know. Or when we have questions, generally they're asking us to find that one correct answer or one thing that is the best answer in the scenario. So that's why when you see false questions or something that says something except, we panic because our brain needs to do the reverse. It needs to find that one thing that is not true. So that's just a little harder on our brain. So first of all, take the time. Understand this is easily solved. However, you cannot rush it. So take a moment to say, yes, I can do this. Now, second, I'm going to show you how to use the true or false game in order to solve this question. It's going to be really, really easy. After this, you're going to feel a lot more confident going to the NBDHE or NDHCE or any examinations that you have in your life. So if you're in Canada, actually this type of question does not exist, but we have some for you at StudentRDH just to challenge you a little bit with your capacity to solve problems and think logically, okay? So just bear with me, try it, and I promise it's gonna get easier. So let's go on the other side and see how we can use the true and false game in order to solve those problems. So let's try some examples and see what we can do here. So again, the principle is to play the true and false game. Very easy. So let's read the statement here and find out if the answer choices are true or false. We're looking for one that is false, okay? The one that sticks out that tells you this is false. The other ones are true. They're not the correct answer. Here, let's say the following are true about the modified pen grafts except. So you're looking again at that one that is false. So let's play the true and false game. A finger form a safe soft seashell shape. True or false? True, right? What about the next one? Ring finger rests against the middle finger. Does the ring finger rest against the middle finger when you are doing a modified pen grasp in dental hygiene? Yes, it is. So that is a true. And then we have pad of the middle finger rests on the instrument. So here I'm just holding a pen, but I'm just thinking about middle finger rests on the instrument. And is that the pad that's touching? Well, we can also argue that's a little bit more the side of the middle finger that's touching the instrument. So let's just leave that out. But let's look at the thumb and ring finger are placed opposite of each other on the handle. Now let's look at it carefully. Thumb and ring finger. Are they opposite? Or do you think there's another finger that is opposite of the thumb? In this case, it is this one, right? Therefore, D is false. If you read a little too fast, you might not see ring finger. Your brain might just trick you to think middle or index finger, just because in our head that makes more sense. So we're programmed to think that way. However, our challenge is to make sure that we read slow to find the little clues. So that one is false for sure. So that we know C is true. So as you can see here, you found 3 of them that are true and 1 of them that is false. Again, this was true, true, and that is false. So in this case, the answer would be D. This is what you would have to mark. Should we try another question? So I have another one here, and it says, all of the following represent standard client assessment information that is necessary for planning comprehensive dental hygiene care except. Whatever, except. Okay, now I'm ready to play my true and false game. Let's just do it. Let's read the statement. So things are in the standard client assessment information that are necessary for planning comprehensive dental hygiene care are, basically. So I kind of rephrased it again. So basically it's asking me, let me think again slowly, right? That when you have a standard client assessment information to do a comprehensive dental hygiene care, what would you need? That is the statement. So I rephrase that and then I play my true and false game. So you do an extraoral assessment, true or false? True, right? I mean, oral cancer is becoming something that the dental hygienist or the dental team really should be responsible for. So we're looking at marks on the face, we're looking at many different things, even their glands. So extraoral assessment is important. And also it relates to the drugs that they're taking that can affect their mouth. For example, angular colitis. If you see that, you can think maybe the patient has xerostomia or maybe has a fungal infection. So there are many things that are related. So extraoral assessments is important. After that, B, current self-care practices. That means we're trying to understand what self-care they have at home, what kind of brushing technique they have at home. So that is true as well. Dentition evaluation. I mean, you know, every time you have to chart, you have to understand what kind of dentition they have, what they didn't, with the teeth that are missing, the implants they had, things like that. So that is true as well. Let's say fluoride varnish application. Is that true or false that it is in the standard client assessment? It is false, right? I mean, first of all, it is not an assessment. You're not assessing whether fluoride varnish was applied or not. And also, this comes after the treatment, okay? This is not something you do in the very beginning of your treatment or when trying to collect information. Well, of course, you can think, okay, in the chart last time they have fluoride. Okay, that's good. But I would say compared to everything else, this is the most false. So, for this case, D is the answer because 3 of them are true and 1 of them is false. Now, this question, I think, gives you an idea a little bit of that when you have the board examination, it's not just about that one and only correct answer. Now, sometimes you have some gray areas, you know, some things that make sense, some things that don't make sense, but it's kind of a mix, you're not too sure. And D, you know, you can argue that it's important for assessment to understand if the patient has fluoride varnish application in the previous treatments or not. But compared to other ones, this is the best answer. So I want you to just get in the mentality of thinking what is the best answer versus that one incorrect. Because if you get in the mentality of there's only one correct answer and there's a little bit of difficulty, you're going to start thinking, oh, they're trying to trick me, I'm going to fail my board exams. So let's just stay positive and just focus on what is the best. And just like anything in life, there's not just always like black and white, right? In everything we do, there's lots of shades of gray. So we're just trying to find just the best answer. One more example for you guys. Here I said the following systemic conditions are risk factors that contribute to the patient's susceptibility to periodontal disease except one. Which one is the exception? Again, when you have except, don't panic. Think about the statement. The following systemic conditions are risk factors that contribute to the patient's susceptibility to periodontal health. So we're looking at risk factors that are related to periodontal disease. So we can rephrase it saying there are risk factors that contribute to periodontal disease. And then you're trying to think, okay, there's 3 true statements and 1 false statement. So we're thinking about risk factor and periodontal disease. When we think about that, tobacco use, okay, I'm going to actually insert it this time into our statement. So tobacco use is a risk factor for periodontal disease. True or false? This is 100% true. Tobacco use, any type, chewing, smoking, is directly related to periodontal disease. Let's continue. Hormonal changes, hormone changes. So when your patient goes through hormone changes such as pregnancy, does that cause potentially periodontal disease? Is that a risk factor? Yes, it is. PG, pyogenic granuloma, is not just for pregnancy, but we call it pregnancy tumor. Men also can have it. But for example, that gives you an idea that hormones can also cause periodontal disease. Now, diabetes. So diabetes has many consequences, and one of them is periodontal disease, like risk for infection. What else there is? I'm going to write that down here. Infection, dry mouth as well. And then you can have periodontal disease, numbness, tingling, all of that as well. And then delayed wound healing. All of those are kind of things that can happen if the patient has diabetes. That's why it's so important to treat those patients well and to also prevent some diabetes that come related to our habits. So that's that. So another one here, D, is, so that is true, osteoporosis. Osteoporosis. I'm thinking osteoporosis, is that a risk factor for periodontal disease? So when the bone gets weak. That's actually a good question. This one is a little harder, and I would argue that this is false. Like, the bone density itself is really important, but it's not because you have a little less of bone density that you're going to get periodontal disease. For example, my mother, she has osteoporosis. That does not exactly lead to periodontal disease. Now, if you have condition of the bone and the bone is really receding, then you can have recession, that's a periodontal disease. However, just osteoporosis itself is not a periodontal disease risk factor. So I'm going to say false, but let's continue. We're not done here. We have dental calculus formation. So is calculus a risk factor for periodontal disease? And this one is an absolute true as well, because calculus serve as kind of like protection or housing or kind of structure where biofilm can accumulate. Now, biofilm is full of bacteria. The bacteria, if you leave it there, turn into some harmful bacteria that can actually cause periodontal disease. So it just is a structure. If you think about it, let's say there's like a snowstorm, and if you have a wall, the snow is going to accumulate that next to, so I'm going to try to draw a brick wall. And by the way, guys, I'm just having this on my hand. That's why I'm looking back and forth, the screen here and my camera over here. So we have this brick wall, and we are going to have snow. Now, if you know me, my drawings are very, very terrible. Let's see if I can even draw some sort of, I'm just gonna draw a blizzard. Like, let's say, like, we had a blizzard, and okay, so here we're gonna start have a pile of snow that accumulates right there on that brick wall. That's basically calculus. Now, snow is okay, in this case. But if we have calculus, we have bacteria that accumulates in our mouth. That is not good. That will cause periodontal disease. So in this case, I would say D, osteoporosis, is one that is false. Now, you can argue that osteoporosis is a risk factor, and that can be true in some cases, but again, I asked to get the best answer. It's not always black and white. So let's just get in that mentality of trying that one answer that makes the least sense in this case. So we reviewed just a few examples over here, and we started with something that's a little bit more simple. We looked at the statement and see if those are true or false, and then we looked at something a little bit more difficult. And then here, again, the difficulty level is a little, it's a step up again. So the whole point, though, when you have a question that is about something except or something false, don't panic. Take a breath first, and then you are going to look at the question. You're going to rephrase the question. You're just going to think through in your mind, and then you're going to tackle the question answer choices one by one by saying, is this true or is this false? And you're looking at that one false statement. For the rest of the question that are not except or false, you just treat it like a normal question. You just find the one that is true. So you have 4 false or 1 true if it's a 5 answer choice. If you have 3 answer choice, 2 of them are false and 1 of them is true. So I hope this clarifies that. It's kind of just the opposite of what you would do in your normal questions. But again, don't panic, because a lot of times we make mistakes because we are panicking. You can take a few more minutes here in this type of question and go a little faster in other question. Honestly, I barely hear students saying I failed the board examination because I was a little too slow. People actually go really, really fast and just finish, in my mind, a little too early. So know that you have a lot of time. You are not going against the clock. Just take more time here and you can catch up in other questions. All right, so I wish you the best, and I will see you in other videos and at StudentRDH. Bye.